Inflationary pressures are not only causing problems at the gas pump and grocery store, but more Americans are feeling the pinch when it comes to taking care of their health. A recent Gallup survey found 4 in 10 Americans with health insurance have put off medical care because of rising costs. Well, here to explain more about what's happening to America's healthcare system is Katy Tolento. She's executive director of the Alliance of Healthcare Sharing Ministries. Katy, it's good to talk with you again. So many Americans would say the healthcare system is broken. So what's the biggest reason that people are finding it more difficult to afford and obtain quality treatment now?
Well, I think it's broken for us, but it's working exactly as designed for the healthcare industry, who it benefits quite perfectly. So I do think that how it's designed is to maintain secret prices, secret contracts between all these actors in the healthcare industry, whether it's giant corporate hospital systems that are pretending to be charities for the IRS, or shady middlemen in the drug supply chain called pharmacy benefit managers who refuse to show anybody their compensation and their funding streams and their prices. And the kickbacks that they receive from drug manufacturers, or maybe it's the private equity doctor practices that are surprise billing everybody after you go to the ER, or your anesthesiologist who charges you for your surgery turns out to be out of network, even though your surgery was at an in-network hospital. I mean, ultimately, this comes down to simply price transparency in every industry except healthcare. We know the price in advance. And if you don't, you're not allowed to charge under the Uniform Commercial Code more than fair market rate.
Well, it seems like people have to wait forever now just to get an appointment to see a doctor, schedule surgeries, other procedures, tests. So why is that? Is there a shortage of healthcare workers? If so, why?
Well, I think part of the reason is that we fired a bunch of them when they didn't want to get vaccinated during COVID. So there's that. There is a real shortage of nursing staff for largely that reason, but also nurses are underpaid. And that limits how many patients can be seen at a physician practice, because they often depend on nurses to kind of keep the trains running and keep the patients flowing. But also, fewer and fewer people are going into medicine. I think that young people are starting to be disillusioned. I know that for people of faith, it's a real problem to protect your own conscience rights during the medical education process. So it's illegal in some states to get out of medical school without having to participate in or learn how to perform an abortion. So these are reasons why a lot of people are no longer going into medicine. I think they're starting to see the corruption of it. You hear about horrible burnout rates and even high suicide rates among physicians who, are stuck in this big corporate machine that they never imagined when they were first wanting to help people and go to medical school. It's just not a pleasant industry to be in. You kind of feel like you're in a giant bureaucracy and you're not really able to help people. And more you're at the whim of corporate and capitalist and sort of greedy, to use that word, interests that are dictating clinical decisions and interfering in the exam room. And I think that, more and more people of good integrity, they don't want to be part of that system, and for good reason.
Well, you probably watch the presidential candidates closely. Who, in your opinion, right now is proposing the best health care plan?
Well, none of them are really proposing a lot of healthcare plans. I think that especially Republicans have always viewed healthcare as a losing issue for them, because I think they think that, well, the Democrats are offering everything for free and we can't offer that. And so we don't want to come in and just offer, less than them. So we'll just say nothing about healthcare, which I think is a huge mistake. But I will say there is an exception, and that's President Trump. He came out and talked about an initiative on chronic disease and children's health, which I think is the most underreported story of a generation, is how sick our children are. More than half of all children have a chronic disease. This is totally unprecedented, and it's due to many factors. But he has come out with an initiative around that and around studying the causes of it, and especially studying some of the regulatory causes of it. I mean, we're seeing more and more products being approved by the FDA without good research on their effects in children, and they're being prescribed off-label to children, whether it's the entire vaccine schedule, which does not have very good safety data, no placebo-controlled trials for almost all of the vaccines, or whether it's obesity drugs that are being approved and recommended for children. And more we're seeing kids who are really being poisoned by our processed food supply. And there are additives and chemicals in our food supply that are not permitted in any other country in the world that are permitted here because of political influence of the giant corporate food industry. So I do think that President Trump is talking about that. That's exciting. He also has a record on this issue when it comes to taking on drug pricing, taking on price transparency that I was talking about earlier. So, he has some record. I know that Governor DeSantis definitely has a great record on COVID in Florida, where he took on some of these, really corrupt public health interests and regulatory interests as well. But the other candidates I haven't really heard much from on this issue.
Okay, we'll see what they have to say in the months and weeks ahead. Katy Tolento, the Alliance of Healthcare Sharing Ministries, thank you for setting us straight today. We appreciate it, Katy.
My pleasure. Thank you.